First, we'll start with a little background information about the elderly population. Older Americans now comprise the fastest growing segment of the United States population. The 2010 U.S. Census recorded that 40.3 million people aged 65 years or older comprise 13% of the population. By the year 2020, this group will increase by nearly 5.5%. As a result of the number of older Americans, the number of elder abuse cases will also increase, and the impact of elder abuse as a public health issue will grow. Victims of violence have twice as many physician visits when compared to the general U.S. population, allowing opportunities for discovery and intervention. Physicians and nurses are in a unique position to identify, advocate for, and help manage this vulnerable population. Key issues and risk factors include living situations, individual diagnoses, such as dementia or Alzheimer's, a handicap diagnosis, family relationships, or the lack thereof, the level of independence or dependence an elder has on others, ageism, or the prejudice or discrimination on the basis of a person's age, hopelessness, isolation, the fear of losing family relationships, and a fear of losing a sense of security. Types of abuse include physical abuse, which occurs when an elder is injured, assaulted, or threatened with a weapon, or inappropriately restrained. Sexual abuse is any sexual contact against an elder's will. This includes acts in which an elder is unable to understand the act or is unable to communicate. Psychological or emotional abuse occurs when an elder experiences trauma after the exposure to threatening acts or coercive tactics. Examples include humiliation or embarrassment, controlling behavior, social isolation, disregarding or trivializing needs, or damaging or destroying property. Neglect is the failure or refusal of a caregiver or other responsible person to provide for an elder's basic physical, emotional, or social needs, or the failure to protect them from harm. Examples include not providing adequate nutrition, hygiene, clothing, shelter, or access to necessary health care, or the failure to prevent exposure to unsafe activities and environments. Abandonment is the willful desertion of an elderly person by a caregiver or other responsible person. And finally, financial abuse is the unauthorized or improper use of the resources of an elder for monetary or personal benefit, profit, or gain. Examples include forgery, misuse or theft of money or possessions, use of deception to surrender finances or property, or the improper use of guardianship or power of attorney. Now, let's look at the case of an elder abuse scenario. Recently widowed elder woman forced to move in with her son due to her dependency needs. However, her son has a substance abuse problem, and he steals money from her to support his addiction. The elder is neglected and left with minimal support. Her son fails to aid his mother in healthcare needs, such as driving her to doctor appointments and picking up her medications from the pharmacy, things that her husband used to take care of. When he is under the influence, her son verbally and emotionally abuses his mother, such as humiliating and ridiculing her and blaming his problems on her.
Good morning, Mrs. Smith. This is Nurse Marissa. I'm just leaving you a message to confirm your appointment for later today. Since you've missed the last couple of appointments, I've been a little concerned, and I just wanted to call to make sure that you're coming today. I'm not sure if it's a transportation issue, but I hope everything is okay. All right, Mrs. Smith, I hope to see you later. Bye. Good morning, Mrs. Smith.
Oh, good morning.
I'm happy to see you. We're ready to go into room 2? You can have a seat right here. So, how are you today?
I've had better days. It's been hard since my husband passed away. But please call me Betty.
I'm so sorry to hear that. Losing your husband must have been so difficult for you. Have you felt hopeless at all?
Well, I have been very sad, and I feel like I've lost control. My husband would do so much for me. I am living with my son now for the last 3 months, and it's very different. It is harder to live with him than I expected it to be. I thought I knew my son so well.
It is important for the nurse in a therapeutic manner to gather information from Betty, such as her situation at home, her relationship with her son, support systems, and her fears and anxieties. Communication techniques include actively listening. Listening is essential to understand the patient. The only person who can tell the nurse about the patient's feelings, thoughts, and perception of the self is the patient. Therefore, the first rule of a therapeutic relationship is to listen to the patient. It is the foundation on which all other therapeutic skills are built. Broad questions to encourage her to express her feelings and thoughts. Broad openings let the patient know that the nurse is acceptable, accessible, and following what the patient is saying. Restating is the nurse's repeating of the main thought the patient has expressed. Sometimes only a part of the patient's statement is repeated. Restating shows that the nurse is listening, and it can focus attention on something important that might otherwise have been overlooked. Clarification is when the nurse tries to put into words vague ideas or thoughts that are implicit or explicit in the patient's verbal message. It is necessary because statements about emotions and behaviors are rarely straightforward. Silence on the part of the nurse has varying effects, depending on how the patient perceives it. To a talkative patient, silence on the part of the nurse may be welcome, as long as the patient knows that the nurse is listening. Silence can prompt the patient to talk. Some introverted people find that they can be quiet but still be liked. Silence allows the patient time to think and to gain insight. Focusing helps the patient expand on a topic of importance. It can help the patient become more specific, move from vagueness to clarity, and focus on reality. How would the nurse move forward with this interview? What types of communication would the nurse need in order to gather adequate information to help her patient? It is important that as a nurse, we keep an open eye for all forms of potential abuse. Again, these include physical, sexual, emotional abuse, neglect, abandonment, and financial abuse.
So, how does your son treat you?
He tends to have a temper, and that worries me. On stressful days, he ignores me and is consumed by drinking. Sometimes it feels like he finds alcohol more important than me.
Yeah, that happens a lot with family. You'll be fine.
But he's yelled at me before and threatened to put me in a nursing home, and he makes comments about me being a burden.
Believe me, it could be worse. Nursing homes really aren't that bad, and you shouldn't be afraid.
And it's not only me that is grieving. Maybe this is his way of dealing with the death of his father. His ways will eventually turn around.
I don't know. I wouldn't get your hopes up.
I don't know what to do at this point. I'm starting to feel hopeless and losing all sorts of control.
A lot of people your age start to feel this way. Oh, time is up. I have to get to my next appointment.
Clearly, Nurse Marissa did not keep mindful attention to the therapeutic communication techniques or retain respect for her patient. What would you have done? What should or could the nurse have done differently? What caused the barrier in communication?
How does your son treat you?
He tends to have a temper, and that worries me. On stressful days, he ignores me and is consumed by drinking. Sometimes it feels like he finds alcohol more important than me.
I'm so sorry to hear that. What about his temper worries you?
He has yelled at me before and threatened to put me in a nursing home. He makes comments about me being a burden. It is not only me that is grieving. Maybe this is his way of dealing with the death of his father. His ways will eventually turn around.
This must be hard for both of you to deal with. Maybe it would be beneficial for your son to come with you to an appointment so that we could all openly talk about this situation.
I wish I could say he would do that, but it's hard enough to get him to take me to my appointments. I ask him to drive me and he always makes excuses. But it's okay. I try to get a neighbor to drive me. My son has done enough by letting me live with him.
I have noticed that you've missed some of the last few appointments. Do you think that this drinking problem stops your son from driving you to your appointments?
What did Nurse Marissa do differently this time? How did she facilitate communication rather than hinder it? Can you identify what kind of abuse is portrayed in this scenario? We found that emotional, financial, and neglect are all present. Elder abuse can have several physical and emotional effects on the individual. Many victims suffer physical injuries like minor cuts, scratches, bruises, and welts. Elder abuse can also have emotional effects as well. Victims are often fearful and anxious. They may have problems with trust and be wary around others. It was reported that 1 in 10 elders report emotional, physical, or sexual mistreatment or potential neglect in the past year. Many cases are not reported because elders are afraid to tell police, friends, or family about the violence. The CDC has a 4-step approach for elder abuse prevention. Step 1 is to define the problem. Before we can prevent elder abuse, we need to know how big the problem is, where it is, and whom it affects. Step 2 is to identify risk and protective factors. It is not enough to know that the elder abuse is affecting a certain population in an area. We also need to know why. Step 3 is develop and test prevention strategies with the patient. And step 4 is to ensure that widespread adoption and understanding has been made between the nurse and the patient through effective communication.
So Betty, after talking, I feel very concerned about how you've been treated since you've moved in with your son. And I want to help you realize that the environment you're living in is not a healthy one for you.
You are right.
Now, in the state, it's my duty to report how your son has been treating you. And your safety and well-being is of highest priority to me. And the only way for me to ensure this is if I report this situation.
I understand your responsibility to report. I now know that my home situation is not good for me. I haven't addressed my home situation with anyone for the fear of being abandoned by my son and losing the only family I have left.
I understand.
I'm afraid of being put into a nursing home.
Betty, we will get through this together. Going to a nursing home is not your only option, and I can offer some resources to you and go over them with you.
Thank you, Nurse Marissa. I really appreciate your concern, and I'm open to any resources you can provide to me.
As we saw, Nurse Marissa explained to her patient that it was her duty to go ahead and report the situation. In accordance with the Connecticut state law, any person who has reasonable cause to suspect or believe that any elderly person has been abused, neglected, exploited, or abandoned, or is in condition which is the result of such abuse, neglect, exploitation, or abandonment, or who is in need of protective services, shall within 5 calendar days report such information or cause a report to be made in any reasonable manner to the Commissioner of Social Services or to the person or persons designated by the Commissioner to receive such reports. Any person required to report who fails to make such report shall be fined not more than $500. As we saw, it was Nurse Marissa's duty to report Betty's situation. She also used all communication to preserve the self-respect of both individuals in the communication. She also kept in mind that one should communicate understanding and acceptance before giving any suggestions or advice. How to report elder abuse. If you suspect elder abuse, you can either report the situation to local authorities, as we saw Nurse Marissa do, or refer the individual to a quick help hotline. The goal is to stop elder abuse before it starts. While not much research has been done, there are several things we can do to prevent it. Listen to elders and their caregivers, as often they are the first ones to acknowledge and recognize abuse. Report abuse or suspected abuse to Adult Protective Services. Educate oneself and others about how to recognize and report elder abuse. And learn how the signs of elder abuse differ from the normal aging process. If you take care of an elder, here are some things you can do to prevent violence. Get help from friends, family, or local relief care groups. Take a break. Involve more people than just family in financial matters in order to avoid discrepancies. Seek counseling or other support if you are feeling depressed. And if you are having problems with drug or alcohol abuse, get help. Can you identify any other interventions the nurse could have utilized? What kind of resources do you think are available to Betty?